Hey everybody, this is Beth Durinsky from Odyssey Insurance and Investments, and you're listening to the podcast, Real Insurance Made Simple. As a working mom of young kids and a small business owner, I know firsthand life happens. So come along with me and learn how your insurance policies work when real life happens and you need them most. Good morning, everybody. I hope everybody's week is off to a great start. Today, I want to hop on here to discuss Medicare Prescription Drug Plans and the big changes that we're seeing from this current year of 2024 to the next year of 2025. We're seeing these as we work through the annual enrollment period right now. The big one is, for those of you, especially who are on those expensive prescription drugs at the pharmacy and you're used to hitting the donut hole or the coverage gap, those terms are used interchangeably, that is going away for 2025. So the out-of-pocket cost that you will experience for prescription drug plans they have been significantly cut. So last year, or this year, I shouldn't say last, this year for 2024, we're seeing the deductible for your average prescription drug plan, or the highest threshold that the deductible is allowed to be, is $545. And then you have your different thresholds. So you have your first stage, which is your deductible threshold. And then you go to your initial coverage phase, which is $5,030. And you stay there until your costs reach $5,030 with your copays and such. Then once you reach that, you move into the donut hole, or the coverage gap, where you then pay a percentage of retail up to the cost of $8,000. Then once you met that threshold, then you moved into catastrophic coverage. That's the way it is now. But starting 2025, it is actually going to be different. So we're seeing the deductible go up to $590, and then you have your copay stage until costs reach $2,000 is my understanding. I'm pretty sure that's correct. And then after that, you're done. So that is completely different. Big change in out-of-pocket cost from this year going into next year. And that starts on January 1st, 2025. We are seeing plans change significantly for prescription drug plans as far as premium goes. Like particular companies are combining some of their plans and increasing cost here. There's not as the premiums are definitely, I think, increasing overall. Last year, the average monthly premium was $55.50, and this year it's saying it's $46.50. But when I look at the ones for our area, we had more like $19, $20 options, $10 options, and there is still a $0 option for our county specifically and the neighboring county. But the next option after that, we're looking at $30 and $40. That $20 option and that $10 option for our area seems to be eliminated this year from what I can tell, but it is based on your zip code and where you live and different things. So definitely reach out to your local agent if you're on a standalone prescription drug plan and you want to review that and what that looks like for your current prescriptions, or if you've had any prescription changes in the past. And just see how you're impacted by these changes. They're, for the most part, as it goes to coverage at the pharmacy, costs are coming down, but it looks like premiums are going up. So definitely just evaluate that. In order to properly evaluate that, your agent will need the name of your prescription. If you are on the generic, they will need the generic name, not the name brand, the milligram or the dosage that you take, and the frequency that you take it. That really allows them to successfully do their job. We would love to help you and review with you. Please do not hesitate to reach out to us, 812-932-2200. Again, we're here to help. Just review. If you're on the best plan for you, we're going to say, hey, you just need to stay where you are. We're not going to try to sell you something that you don't need. So that's something just to review, to consider. Give your local agent a call. Typically, your standalone prescription drug plans are paired with your Medicare supplements or just original Medicare. This is separate than a Part C Medicare Advantage plan, although you can review those as well. Now is the time, the annual enrollment period, but that's a different conversation. So please don't hesitate to reach out. We are here to help you in any way that we can. And we look forward to talking with you. Everyone have a wonderful and blessed day and a wonderful rest of your week. Thank you all for listening today. We hope you found this episode helpful and informative as you navigate the world of insurance. As a reminder, this podcast is never for legal or professional advice, and you should always consult your local and licensed insurance professional. We wish you a week filled with love and blessings from the team at Odyssey Insurance and Investment.